service. I understand that everyone here, you're already doing an incredible job within your service. And I know that you are doing everything possible. That's why you are on this platform this afternoon. You could be doing anything. I mean, it's almost lunchtime. It's lunchtime, so you could be doing anything, but you've decided to be here. So we do appreciate your time this afternoon. So this is the first slide. As an organization, we are Dominion Consultancy Group. We are a quality assured care learning organization by Skills for Care. We've had our endorsement for the last consecutively for the last 5 years. We are also an approved provider with the Hertfordshire Care Provider Association. For me, my name is Olayinka Thomas. I'm a former registered CQC registered manager and also a CQC, an operational manager supporting different branches, over 10 branches that are doing over 20,000 hours. So I've been able to learn my way up. I started personally as a carer myself over 16 years now, and it's been an incredible journey. In between that, I've gained some qualifications in terms of business management, level 7 in health and social care, and level 5 in health and social care, also currently doing my MBA. So I'm very passionate about care because it's something that is very passionate to me as a person, stemming from my younger age, supporting my grandmother, who unfortunately died on my birthday. But so that just shows our bond and the care and the love we share. So it is something that is very passionate. I'm very passionate about. Care is something I'm very passionate about, especially adults and children. I started working with adults and then going into children. So I would be that's a little bit about myself. If you're meeting me for the first time, you're welcome once again. So over the years, aside from being an operation manager, over the years, we've supported organizations that are starting their care services, or they are already in the process, or they already started. It requires workforce development. So we've been able to support organization. And because of the quality of the service we provide, Skills for Care also approved us. So with today, I like the 6 C's in medication. You can tell one of the 6 C's, the 6 C's, the values when it comes to health and social care. We have courage, we have care. So, and that's why I've been able to simplify this to just put it in 3 ways. As an organization, what you need to think about is that you need to be clear. First of all, be clear about what service do we deliver. Because once you're clear about that, then you would be able to know what comes next after that. So if we know the service we're providing, are we providing personal care services? If it's a personal care, what sort of age range are we looking at? And because over the years, we've supported people with the registration. And some people come, they are so passionate. Some of them are nurses that have worked within the healthcare system, some within the NHS, and they want to move into caring now. It is different because one isn't within the community, or it could be within a care home. And when you ask them, what sort of service do you want to provide? Majority of them are not sure. So you have to be clear about the service. First of all, the service age range, they have the age brand. So is it from 18 to 16, 65 plus? So you have to be clear, because once you are clear about that, then you know what follows. Okay, what sort of staff members do we need for this type of service? What sort of training services would be required? What auditing and compliance would be required? So everything follows from having the first thing, which is clarity. Clarity is very important. Then we'll also look at how do we fix it. So if there has been mistakes, I've met incredible, and when I mean incredible managers, I've met incredible people where their services has been rated requires improvement. Even some people in one of the sessions have been rated inadequate. But when you meet these people, you can tell they're passionate. You can tell they love their service users. You can tell they're good leaders within the service because their staff can't stop praising them. But there is something that is still holding them back, is they don't know how to fix. They might have identified some problem within their services. And as you know, because I've been a registered manager, I know the restraints that comes again, because then you have to wait for, you probably know what to do, then you have to wait for the directors to approve. So maybe you need more training, or you need more compliance, or you need even support auditing within your service. I know what it's like, because I then have to wait for my manager or for my director then, to then approve what I've found. So it is how to fix it. And some people, they may not even know how to fix it. It could be as a result of experiences. So we'll also look at that today. And then not just how to fix it, because sometimes we do a one-time fixing and then we think it's going to fix all. No. So it is the consistency of it. And that's why having a system in place is so important, that they will be running one after the other. So, when you take a step, you know that you're how to take the next step, you know how to take the next step. Just like a driver in the car, when you get to your car, if you have any issues with your car, for example, probably the engine, the lightning, or the ball, or anything about your car, you take the car to a mechanic. And that's what some people do. You find a mock inspectors, you find an auditor's consultant. They come to your service. They tell you what is wrong with your service, or what you can fix. They support you to fix it. But then remember that you are the driver of that vehicle, so you require consistency. So in the morning, you probably start your car. You need to start your car. You need to put the gear on. You need to turn the steering wheel. So, and that is what it's about. Without that, you may be thinking, oh, what am I doing wrong? Whereas it may just be a little bit of switch that you need to click on, and everything. And once you do that, what then happen? The car starts to move itself. So, and of course, and at one point of junction, you need to use your ignitions as well. So that's what consistency is about. So that's what we'll be looking at. Just for refreshing, again, it is not teaching. It is not about teaching, but just to refresh what CQC inspection is like. I haven't worked within the health and social care for the last 16 years of my life. I know what it's like to be inspected as a care worker, even as a care coordinator, as a registered manager, and even as operation. But because at this level, there are different things that it means different things to different people or different colleagues. So to your care workers now, what CQ inspections for them is different. As a responsible individual or registered manager within your service, what a CQC inspections is different to you, because then you're responsible for that service. So it is an official check that it has to be carried out within the United Kingdom, in England. And the role of CQC inspectors is to make sure that everyone receiving service within your organization, they are receiving a safe service, they are receiving an effective service, they are receiving a responsive service, they are receiving a service from the organization that is caring, and also it is also well-led. And most importantly, that well-led session is where most people get it wrong sometimes. Not getting it wrong in a way, but that's when they see gaps. So once there is a gap in the well-led session, it could affect every one of the CLOE. So they call this key line of inquiries. It can affect every one of this key line of inquiries. So at inspection, just to recap again, at each inspections, what do the CQC inspector look for? Within the service, for example, are the service user, do they feel safe? And there are different ways they can do this. So they can speak to the service users, to the people that you deliver service to. They can speak to the carers. So they could ask the carers, for example, what are the different types of medication? What are the different ways you can administer medication? Do the staff know about that? Because if they don't, then it could give an indication to them that they may not know how to care for that service. How to care for the service. Yes, we might send this recording later on. I will discuss that with my colleagues. So do the service users, do they feel safe? So it could be from you also carry out what we call spot checks within your service. So CQC can also be there one time whilst your carer is delivering service. If you're working in a care home, or it could be in a service user's home, they could also be there. They're watching what the staff members is doing. So now, how does that then affect the well-led? Because the manager is not there at that moment in time when the care is being delivered. It's only the carers, probably it could be a two carer service that is required, so double-ended service, depending on the service that is required. But why does it so affect the well-led? So it could be that the CQC have identified some gaps in the care staff training and in their competence. I'm not going to say training, in their competence level with the way, because of the way they are delivering the service to the service users. So how does it then affect the well-led session? So if they've identified any gap in the staff competence, it could affect the wellness session when they ask the manager of the service, do you know about this? And if that had not been identified, for example, you could have identified that, oh, the carers need some training on moving and handling. And the CQC inspectors have identified that gap during their spot checks, during their visits. Now, if they speak to the inspectors, if they speak to you as a registered manager or as a responsible individual within that service, and they realize that you've not identified that gap, that would be issues in terms of your compliance. But however, if you've already identified that gap, so let's say, for example, you've already identified, or maybe they need a refresher training as a result of the spot checks that has been carried out on that particular care staff, then under well-led, it shows that you're doing your governance, you're doing your compliance checks, and you're doing your spot checks, and everything is up to date. But if there's any discrepancies there, then the CQC are thinking, okay, do this manager, do they know what they're doing? So they look at people's experiences, they look at the staff practices. Are they competent? Are they well trained? Do they follow the care plans? So if the care plan says A and the individuals is delivering B, so what are the discrepancies between the two? And as the management of the organization identified this gap, so that's what they are looking at. And medicines, given safely as well. They're also looking at that. They're also looking at the leadership. Is it well organized? Who is leading this organization? Is the manager well trained? Do they have the competency, within the service that they need? Are there any issues identified, and is it fixed quickly? So it's not enough for you to identify a gap. So for example, during the last spot checks, you identified a gap that one of your staff members required training in moving and handling, and 1 month had gone by, and you've not carried out that training. Even though you've identified it, you need to make sure that is fixed quickly. That is fixed, because if you're leaving it and you're still sending that same staff to the service users, you know that you're putting the service users at risk. So these are just some of the things that CQC will check. They also check the records, of course, the records and systems. And I don't have to remind you of that. They check your risk assessment, your care plans, your incident reports. So, and more often now, they're moving from just paperwork. So it's not just about what you show them. They are looking at the real life experiences. They're hearing it from the service users. They're seeing it for themselves, and also doing their monitoring checks every month. So this is just some of the things that they do. And we're using some of the instances for you as well. So, and at the moment, the reality is they're more data-driven inspections. So that's the new approach. So they're using the single assessment framework, which has been scrapped as well. So people have always talked about the single assessment framework, and you want to let, I know that organization, you want to learn about it, and the CQC is saying that, okay, we're going back to what we used to use before. But initially, people were like, okay, what is the difference? You don't have to worry about the difference, because it's still the same inspections that will be carried out. But what has changed is the scoring. They wanted to use a scoring system initially, or in a particular way. And if you miss a score by 1 point, that could be the determinant between requires improvement and good. And some people have said, oh, that is actually good. So at least I know what I need in between. But another set of people have said that is not fair. Because imagine if I've done everything right, so just 1 score or 2 scores, I've made me to be under requires improvement. So there's a bit of, mixed feelings about that. But what I want you to have in mind today is the ongoing monitoring. And I want you to ask yourself that if I'm being inspected today, if I have a court today, what would the service look like? Will I still finish work at 5? Will I still pick up my bag and just, go home at 5 p.m. and then just wait for CQC inspection tomorrow? So, and that is what this is about. When you have that system in place, you ensure that it doesn't matter if they call at midnight, you are there. You can come and check what I'm doing because you're doing that on a regular basis. And the focus of quality statement as well, instead of just the glories at the moment. But let's be honest with ourselves. Many people have remained requires improvement for years. CQC has some backlogs, but recently they've been able to do thousands and thousands of inspections, making sure they're up to date. Thousands, over 6,000 of inspections that they've carried out. And they are still over 6,000 applications and also inspections that they've carried out over the last 12 months, which is an incredible, increase on what they are doing. So training is not just happening. Of course, I know that you train your staff members, but is the practice, is it consistent as well? When you audit your service, when you audit particular, I do understand the high staff turnover as well. You train some staff members, they leave your organization and you're having to train again. And sometimes the audit could repeat the same issues. When you identify that gap, what are you doing about it? Have you just, identified it and just leave it like that to say, yes, at least I've identified it. I'm just going to put it in a book. You need to do something about it. Managers are overwhelmed. I've spoken to one manager at least today that have just called me. They have an issue with one of the service users regarding one of the regarding one of the clients. I'm not going to go into details, but every day I'm speaking to managers that are overwhelmed, and sometimes some managers are reactive. So you wait for the problem to happen and then react to it. So what we're trying to do is to make sure that you're being proactive. So before it happens, you already identified that issues. And most managers are unsupported. I know this because I've been a registered manager myself. And I know what I went through. For the first 2 years of being a registered manager, I had to put my foot down because I said to my director, see, when CQC arrives, when they come to inspect or to audit, whatever, I will be the one they would be speaking to. So if you still want me to work with your organization, this and this and that needs to be put in place. So some managers are unsupported. There was a time we had less coordinators. I was doing the coordinating. I was doing the management. I was doing the auditing. It was too overwhelming for me. So it is not just about the people that are within the service. It's also about the system. And I looked at it because, again, as a registered manager, you become a registered manager one time. It's not something that I've done before prior to that time. So I was a bit overwhelmed. But when I was able to get my balance, that's when I then stood my ground to know, okay, these are the things that are not good for the service. So what are the core problems now? What are the core problems? One is looking at the regulations. So looking at the regulations, for example, sorry, one second. Okay, I hope everybody can hear me. So I'm getting some messages that, okay, brilliant. I hope everybody can hear me. I'm getting some private notes that my video is not showing. Am I still, okay, 1 second. Okay, all right, great, thank you. Thanks for that. Okay, brilliant. So looking at the regulations now, like Regulation 17, and some of the other things is we look at the regulations, we look at all those big words, Regulation 17, is it safe? The leader, do they have the leadership oversight? Do they have a system in place? Do we have trainings? Of course you do trainings. Of course you complete trainings. But when we look at, let's take it back to the Health and Social Care Act. The Health and Social Care Act started, 2008. That's where the regulation came from. And it looks at the good governance. And CQC is particularly they take this session very seriously. So what is the regulation about? Is about how well your service is run. That's it. Not just what you do. How well do you run your service? For an instance, one of the clients that we just delivered training for, on the day of the training, that's when they had their inspection. They were having inspection. CQC happened to be there on that day. And prior to the time we arrived, they said to the client, to this particular care provider, give me your two best file. That's all. Your two best file. Just get me your two best file, two clients and two staff members. So of course, that sometimes you wouldn't know some of the services that their care plans or their documents, that folders is completed. It was a time where there's not a lot of digital was happening then. It was more of paper. So the care plans is written on the what document, printed out and everything. So she went ahead, brought out a two best document. And unfortunately for her, our two best document, the care assessment was not well assessed. And the reason for that is the person that carried out the assessment didn't have prior training. So, of course, assessment questions, ask questions, some questions and answers, but there are some bits and pieces that some of the untrained staff may overlook. So I will mention this. It was on the client is diabetic. So what didn't happen is in the care plan, it was written there. That's fine. That's quite all right. However, the client also has mental capacity. So according to Mental Capacity Act, they can administer their own medication. But then there was no subsequent solutions. What happens if the client is mental unconscious? What happens if client is unable because of that condition? There should be some follow-up that wasn't identified in the care assessment. And under well-led, the client at the particular time, they were given, they were rated requires improvement. Because what then happened is, if this is your two best file, I wonder what the worst files will look like. They only checked 4 files, and that was it for them. That was on a particular that situation. And I know this person is a good person. This person means so well for their client. This person wants the best for their client. This person has spent so much money training, just doing the mandatory trainings. Oh, let's cover medication, let's cover this, but not actually, even the office staff members also requires training. The person that will go to assess the client also requires training. And prior to that person's inspection, they had contacted us then to say, okay, can you come and carry out a mock inspection? And they cancelled. Last minute, I can remember that day, we were already on our way, and I just called and said, oh, sorry, actually, some of the staff members, we're already on this. I think we can sort of do it ourselves. I believe everybody can do it themselves, but there are some times you just need a third eye. And this is what happened when I was a registered manager. There are some things that you may not see that other people can see. And don't get me wrong, most of you already have this competent staff within your organization. It's just for you to identify it. Some people, they have attention to details. Some people are very inquisitive where they ask questions. Oh, why? Why this? Okay, if the clients have this condition, shouldn't we do this? Shouldn't we do that? But some organizations, you already have that, don't get me wrong. But at that particular time, the client had cancelled their mock inspections. And that well-led stayed there for over 3 years. For over 3 years, they had that well-led. And of course, later on, 3 years later, in 2024, they got back their good rating. But then they have to put system in place. So what the Regulation 17 is saying, do you have system in place? And does this system work? So there's no point having a system in place, paying for all of these apps and softwares where they don't work for your service. It's not all softwares that work for your service. So you have to identify which one works best. And it may not be the popular ones. It may not be the popular ones that work for your service. So do you have system in place? That's what Regulation 17 is talking about. Do this system, do they work? Do you check and improve them consistently? So what the CQC identified in that case was, did you actually check? Because you signed it off as a manager, for every care plans, you sign it off. Yes, I've checked. Did you actually check? And if you check, did you understand what this meant? So, and we have technology now that can help us and that's why I love some of the registered manager groups that I belong. Some of them, you're not afraid to ask questions, which is brilliant. It's better to be safe than sorry. So ask questions, ask questions. So what I'm saying in essence is, are you in control of your service? Or are you just reacting to problems when they arrive? So you need to have this in place, which is very, very important. So the other one that we'll look at is what they expect. It's not just about the paperwork. Are risks identified? Is it assessed? Is it reviewed? Is it mitigated? And the staff, are they competent? So competency is not just we've trained them. One of the issues, another case of a registered manager, they had a particular training. I'm not going to mention the training name, but they had a particular training. It was a complex training because they do have a supported living environment, and they had a particular training. The trainer already signed them off and already showed them, yes, you've passed. And what didn't happen is they noticed that the social worker noticed that the staff members were using the wrong techniques. So they had to have an external auditor to come and assess the staff members with that particular service users. When the auditor got there, and it was clear that they were using the wrong techniques. Now, what did happen? So the lady that contracted the training out, contacted the trainer and said, okay, I paid you. I mean, I have the invoice to prove that. You also gave us the certificates. However, it's been identified that the staff members are using the wrong techniques, because if I've given you a job, then I expect the staff members to perform. And do you know what the trainer said? Oh, sorry. When we were training, the parent of the particular service users, they didn't let me. So there was the parent that showed this. And the provider was like, I paid you. And what does the regulation say? I mean, every professionals, depending on the trainings, also have their own regulations. They have the policies. What does the policy say if you're training in a particular area? Same with medication, same with any other training it could be. I said, yeah, but I was trying to, but then you issued a certificate. But the other thing about the provider is, did you yourself carry out a competence check for your staff? So it's not enough that they've been trained, because I tell you, everyone here, you listen to the same thing, but you're not absorbing the same information at the same time. And that's why competency check is very good. It could just be one question or the other that you ask your staff members. You could be doing your meetings, and that's why we have this card within our service that we'll be deploying out very shortly. We have this cards, and this card is like, I don't know if anybody knows about the game that my daughter introduced us to. So we have this card but with the cards, with our cards, is you have different questions, and most of the questions are related to training. So, for example, what are the different medication administration methods? If a service user is on the floor, what would you do? So those are some of the questions, and that will give you an indication if the staff members actually know what they're doing. Because I know that you're already doing so much within the service, but during the trainings, you can throw one or two questions out and see the responses from the people. You can also carry out competencies. For example, you've trained for medication, that's not enough. You need to carry a competency check for medication to know, yes, they can actually administer medication for individuals, because that could be between life and death. Caring, are they consistent in delivery of care service? And then responsive, do they learn from feedbacks? So if service users have identified a particular area, or the care coordinator or field supervisors have identified a particular area in a staff members, are they well responsive? Do you learn from that? Okay, lesson learned during the meetings, does it show? So, yes, we've learned from it, yes, but does it show in your paperwork? Can you prove it? So it's not just we've done it. Do you have it? Do you have it stated in your minute meetings? And if you have your meetings online, for example, Zoom or any other platform, they are very good now in collating your minutes for you. So all of this will cut some admin works. So you don't have to write and write. You can collect the minutes, even the actions to take. So those ones, you can use that as a proof that is what you're doing. Well led. Do you have a strong governance and oversight about your service? So your evidences must show consistency over time. So it's not like we did it last month, so what happened to this month? So, and learning loops, because everyone, as I said, you're still learning. There are some situations that you will face that the first time I became a registered manager, the first month, there was a safeguarding. I know that was the first safeguarding, in between all, that was my first safeguarding, and I wasn't expecting it. It was a leaving service, a living carer that already been within that service before I joined the organization. However, I'm still responsible for the organization. So that the individual wasn't trained by me. The individual I didn't do any induction. All I did, I'm still getting to know the service, introduce myself, getting to know every staff members. But there was safeguarding with less than a month when I became a registered manager. So now, learning loops, what do I learn from there? What are the things I have put in place? There are one lesson learned from that first safeguarding as a registered manager because I wasn't expecting it. So leadership control, I was able to control that situation. But then it wasn't that easy. It was quite stressful for me, but I have to, because I know when I did my registered manager interview, I said, yes, I know, understand. I will be responsible for the service. I will be doing this. I'll be doing this. I had to step up. I had to learn and ensure that such didn't happen again. And it never did. But that is just by the way. So that's what CQC are looking for. So in reality, again, it's not about, did you train your staff? Are your staff competent? How do you monitor their performance? What changes have you made based on the audits? So what changes have you made based on the audits? And this is still talking about Regulation 17 in action. So I've carried out audits. You see some missing gaps in medication. You see some late calls oftentimes. You see some missed visits oftentimes. What have you done about it? What are the steps that you've taken? Maybe the carer is living very far. Maybe the carer is having some personal issues at home. When I do supervisions, I always tell my staff, yes, this is a formal supervisions. We go through the paperwork. Then we have the informal one. Tell me, what is wrong? Is everything okay? Is there anything that you want me to know? Is the family all right? The kids doing well? All those, I still have some informal supervision with them so that that will give me some indication. So maybe some of them may be moving house. That's the time they tell me, because that supervision template is structured. They're not going to be asking, are you moving house? They're asking, what are your next goals? We look at that goals, we look at our ambitions, but it doesn't give me any indication. If my staff is moving house, then I need to know what I need to do next week because I'm moving house. That's also important. That's, it's part of their life. What is happening at home? So that gives me an indication of what may go wrong in the future. And that is what CQC wants to know. That is, are you competent? Do you know to be proactive and not just reactive and not waiting for things to happen before you do something about it? So what are the 5 governance gaps? And these 5 governance gaps, they are linked to the Regulation 17, the governance. So one of the gaps is no real visibility. So there is no real visibility. You have system. Do you have system to assess? Do you have system to monitor? Do you have system to improve the quality within your service? And sometimes it's inconsistent audits. So you have an audit this week. Things happen. Life happens. A lot of things could have just happened in between. And the following week, you completely forgot. Or maybe you didn't forget, you just didn't have the time in between. You attended to clients, you attended to staff members, you attended, also you have KPIs, remember? I had the KPIs. I need to increase the company's profit. I need to put this in place. The staff members need to do well. It's like you're carrying all the burden. So in between all of this, you may not have inconsistent audits. And the other thing is you can also may not have inconsistent audits, not regular, it's not structured. So if it's structured, for example, I know that every Thursday, I have my audit. So if I didn't do it this Thursday, I know that I'm going to have a double to do next Thursday. So is there anything I can move on Friday to ensure that it's done? So do you have a particular day for audits? That's what system is about. A particular day, this is what I do on these days. This is what I do on those days, having structure in place. So my sheets, I'm going to do this month, the medication administration records. And if any issue is found, do I have action plan is in place? Do I have any action plan in place? No performance tracking, no KPIs. You don't have any measurable oversight. So are you tracking how many missed calls do you have? And that's what actually made us we did created what we call the registered manager diary. It tells you what day today for every day has its own page. So today, is there any missed call too? Because I found that's just me. This is a system that worked for me as a registered manager. It may not work for everyone. And some of the registered managers I've spoken to, they also have their own little diary. I mean, before you log in, and sometimes even technology can just show off sometimes, but your notes can never, unless you don't have it with you. But sometimes some people prefer technology, having it on their phone. But do you have the tracking of the missed calls? Do you have trackings of complaints? Today is Thursday, the 30th of April, how many complaints did you receive? 2, 1, or none, 0. Staff competency, you have 10 staff members or 20 staff members or 100 staff members. Do you have enough coordinators for them? Do you have enough seniors? So for your example, if you have 100 staff members, we are looking at least 4 senior staff, senior carer, that will look after the 25, and then they also have the coordinators, they also have the supervisors, and also, of course, you need a deputy. So do you have incident records as well? So not just in the paperwork, you know the numbers. And if you know the numbers, are you keep tracking that every month you want to ensure that the number reduces? So CQC don't expect you to have a magic wand and just make everything go away, because some of you've taken up a service when they already requires improvement. Some of you have taken up service when you're still learning yourself. It's the first time becoming a manager or a registered manager. So they're not expected to have a one, but at least you have a clear records. You have your performance tracking. So, and it is a big regulation failure, because if you cannot measure what is happening within your service, then you cannot improve it, because what you don't know, you don't know. The other one is a weak leadership oversight. You're busy, but are you in control? Are you in control of your service? My daughter was very young, she was about, I had a very young daughter, which was 2 years at that time, and now she's turning 9. So she was 3 years at that time. Now she's turning 9. And those some of the things that happen between then. When I come back from work, or even when I'm at workplace, I'm constantly working. And I know that for every registered manager, you're constantly thinking about the service. But if you were able also to put systems in place, because I know I have a family as well, I have a personal life, I need to give my all to my children, same as the service users. I want to keep them safe. So that's why governance is systems is very, very, is this the most important thing within your service? Some of you may already have it in place that you don't even know that you have it in place, or you don't call it system, but you already have all of this in place. So for example, when you're on holiday, we'll stand in the gap for you. Do you have a deputy manager? Do you have somebody else, maybe coordinator, that stays in the gap? Does the coordinator knows what to do? Do they know about the auditing? Do they know about the compliance? Do they know how to track all of these performance KPIs? Do they know how to track it as well? Because this is something that you can also train them to do. And that's one of the things that I did in my service. Otherwise, I'm just going to, it was too overwhelming. So no structured review of data. That's another thing that CQC will look at. The other thing they will also look at is, do you have improvement loop? So this is what, and this very one is very, very critical. If you don't have a continuous improvement loop, what then happen? It means that you identified a problem, but nothing happened. So same medication error, same carers doing it, same carers going to work late, same carers doing the same thing and the same thing all over and over again, but nothing is being done. Same complaint teams. So, and CQC, what CQC is expecting you to do is identify an issue. There's a medication error. This is the actions that we've taken. This is the improvement that we've made over it could be 2 days, it could be 3 days improvement. It is something. Because if it can be consistent for 2-3 days, then you would continue like that. So this is the issue, this is the action, this is the improvement, and this is my evidence. You have your evidence to show for it. So your evidence could be the training certificate, your competency, the spot checks, no medication during audits, no medication error has been identified. So again, you can train your staff members, but without having all the system in place, that would be performance inconsistency. So what do you do? That's why some of the technology softwares is good, missed daily alerts. So a carer has not administered a medication, immediately you are notified. Or some people have a big, then we have a big screen or big board that we write to. So it depends on the budget of the organization and what you have, what tools you have within your organization. So, but you have to have real-time visibility, daily tracking, live tracking of sheets, you're having a sheet system. Weekly audits, if possible. Weekly, do your auditing every week. Some weeks that you're not able to do it, don't make sure it doesn't carry it over more than 2 weeks, because it becomes so overwhelming. And in between, you may have missed something very, very crucial. So monthly full compliance audits, or even every quarter compliance audit. Assigned ownership. I can never overemphasize on that. make sure that the staff members you have, some of them are also skilled in other areas. They're also skilled in other areas, and sometimes they're also looking for more responsibility. I remember I worked as a carer for a very large for a very large care organization. So it was Extra Care Home. I worked in a very large care organization. We had our own personal emails. It was very posh being a carer. Do you know what they did? They gave us more responsibility, and that actually made us feel better. Because then some staff members have some skills, they're not being utilized. I remember sometimes I even go to my manager and said, you see, I did a bit of accounting. If you need some support in terms of calculating, I can help you with that. I can support you with that. And some other people also have some skills. So in between those times and I have time, because they want to develop their skills as well. And there's no one as frustrated as a human being that have a skill and is not being utilized. So assign ownership to your staff members as well. How that will work, it depends on your service. So no performance tracking, missed visit, medication errors, you can also identify that too. So moving on, we look at what does it look like in practice and signs of no compliance, repeated missed calls, repeated audit failures, medication errors reoccurring. We've already looked into that. And also, of course, the breach of Regulation 12, which is self-care. So staff trained, but they are not competent yet. They're not competently signed off sometimes. So you have to also look at that. So why does the well-led then fail? If we've looked at all of this information, why does well-led fail? Did you know that well-led is your inspection outcome driver? Well-led is your inspection outcome driver. So regardless of what you were doing, well-led aspect is the driver of everything else that happened within the service. So that's when they will realize that there's a weak governance system. That's where they will look at the poor oversight. That's where the question, the monitoring and performance, that's where they identify that. That's where they identify that there's no learning culture. That's where they identify that the leadership is not embedded. So well-led is your driver. I use an example of a vehicle initially. So you need somebody to drive an organization. And people have said many people don't leave the job, they leave the management, they leave the culture. So it is you are the driver of that organization. Again, as I said, becoming a registered manager, it took me some time to realize I was still trying to gain my ground. When I realized, okay, actually, I'm the driver. I'm the one responsible for this service. I had to put something in place. Something has to change. I have to put system in place that CQC, if there's no structure system that runs the service, they see that, okay, this person is not in control of your service. I will make an example for you. This wasn't a CQC inspections. This was somebody that came to us. They needed a mock inspection. And the reason for that is they had a LA, the LA local authorities visited the organization. So when the local authorities visited the organization, yeah, she was very happy. We registered our staff for training. They're completing the level 3. And guess what? They've started the level 3 since 2024. The year is 2026. And the registered manager or the registered manager is also the nominated individual. As I said, some people have passion as a nurse and they come into care. She's also nominated individual. And she didn't. And the LA, the quality assurance manager from the LA said, they've started since 2024. They ought to have finished the training by now. I tell you what, the manager have no idea whatsoever. They had no idea how long it takes to complete a particular course. There was no monitoring in place. So she was excited, the individuals was excited that, I've registered my staff members for this course. They're doing this, they're doing that. But in between the gaps, they're doing a particular course for over 2 years. What are you doing about it? Are they competent to even take that course in the first place? And what did you do? Did they have any family issues? Is there any things that has caused any delay? There was nothing identified. So of course that had affected the staff performance, and the LA's QA was able to identify that. So no tracking of staff performance, no tracking of staff competency, poor oversight as well. So you don't know who is underperforming. You don't know what risk are increasing. So you have to look at that. And when a mistake happens, nothing changes. So do they have the same complaint theme that is constantly repeating themselves? And that is one of the reasons well-led fails, because when you look at Regulation 17, is a very important aspect of the service. So what are the sheets that you need? Not just looking at compliance activity, we need to do training. We need to carry out audits. As I said, auditing is like taking your service for MOT. It is, of course, needed. But remember that when you carry out the MOT yourself, when you carry out the MOT, which is once in a year, you also need to ensure that you're fueling the car with the right diesel. So if your car is diesel, for example, or petrol, you're fueling that car. That's your responsibility, not the auditor's responsibility anymore. So not just looking at policies, your training logs, your one-off audit, it is looking at your monitoring system. Are you measuring the system? Are you improving this system? Do you have evidence of improvement? Again, they don't expect your Rome to be built in a day. No, that is not what CQC is expecting. But they expect that the Rome as a foundation, as the plan in place, are you going to get the materials? That also includes funding as well. Do you know that, okay, I know some service, your payment has been delayed from the local authorities, you're not being paid, and that has affected your workforce development because you're unable to train your staff members. But that's where have you identified that? So how do you get the materials to do all of this? Because they don't expect the room to be built in a day, but have you identified all you need? So you need to move from just policies, training logs, to monitoring, measuring what you're doing, improving what you're doing, evidencing it as well, which is important. So what are the steps that you would take? What you need to do right now as a registered manager, some of you may already been doing it before. Stop thinking that, oh, yes, we need more training. Oh, this person has made it. Okay, I'm just going to put them refresher. Or they're just going to have supervision. No, you need to pause and start thinking. We need a system in place. We need a system that makes things work. We need something that everybody is aware. So when you're taking, for example, if we employ a staff members today, the other staff members are able to tell this is not how we do it. Not a bad culture. You need to have a good culture in place. We already have a system in place. And sometimes it's somewhat hard when you have a lone worker because you're not there all the time. If you're in a care home, for example, you're able to monitor some of the staff members. But it's harder when they're out there in a domiciliary care setting, when they're out there in a supported living environment, maybe they're delivering the support in the client's home. It's hard, but you can still do it. When you have that, so every staff knows they have their responsibility. And if they don't follow, so not just about the policies now, they have responsibility, they have their own, and it comes from you checking their competencies as well. So your goal is you need a consistent staff performance. That's what you need to show to CQC, and a strong governance evidence. So it's not just about what the training that they've had, but consistency of their performance. You're able to blow your own as well. These staff members, they've been able to achieve this. They started maybe with no experience in moving and handling, but they've been able to be trained. And over the months, we've not had any safeguarding or moving and handling. So you have to show that evidence to Skills for Care. So, and that is one. The step two that you need to take, you can take a screenshot of this, but it's something that we help organizations to do. So, for example, an organization that we supported 2023-2024, they've had requires improvement for years. And then if you read about this organization, you would have written it off. I mean, even because the registered manager is also the nominated individual, they are the director of the organization. It was already at a point, they actually came to us because they wanted to register a care organization. So in the process of asking them questions, do you already have experience? They're like, yeah, of course. I do actually have an organization, but I'm thinking of closing it down and setting up another one. And we're like, okay, that is not the issue here because you will still repeat the same thing. Even though you keep opening a new one, you still do the same thing. What went wrong? And reading about the report of this organization, one thing was clear. The individuals did not know what they were doing. You can tell they're passionate. I mean, you can tell from the passion. There's a former nurse. So, you can tell they love to care, they love to take care of individuals, but they don't have the experience of the management, of the leadership, of the capabilities. I mean, being a nurse is different from now, and you are responsible for supervision, Being a nurse is different now. You're responsible for the management for day-to-day running of a particular service. So it's entirely a different thing. And we said, okay, why don't we do this and put that together? First of all, starting from the leader. That this, you need training in this, you need training in that. And second of all, we don't think you're the right person to manage this organization. So they got somebody to manage the organization. They got another registered manager. The registered manager started at level 5 with us. And we started to take them through some of the skills for care training. Also, they actually did Lead to Succeed training with us, I can remember. So we started from this. First, we have to recognize, am I the right person for this? Because you can be passionate about something, but you're not the right person, or maybe you're not even the right frame of mind because you're thinking about finances, then you're thinking about monitoring, compliance. It may not be your forte at that time, which is fine. So we use this workforce. And at that time, in 2023, we never realized we were looking at this. We were using this framework. But one thing we know is looking at the capability of that individual. You're not the right person to run the service. We said, get a registered manager. They were able to employ somebody who has an experience as a care co, field supervisor, care coordinator, and they've been able to run a service. They know what it's like to run it inside, and now they need to develop to becoming a registered manager. And they passed their CQC interview. I could remember it like yesterday. The capacity, the specialist training, is specialist training required? Competency assessment, that is where most times people fail, because looking at, so again, just to give you a bit of context again, this individual they have their nursing qualification, but no qualification leadership and management in health and social care. They both started at the same time. The person that was employed completed it before them. So that's just to tell you, they're not really interested in the management of the organization. Again, people are different. The capacity structure. Do they have a clear roles? Who is responsible for what? Do you have a team structure? And this is, when you're registering a new service, CQC asks these questions. Sometimes you just do it because of, paperwork's sake. But if we actually sit down, one of the things I ask every of the registered manager that comes to me or nominated individual that comes to me, oh, what do I do with this? As a matter of fact, when this individual was having that inspection, they came to us, oh, they're having an inspection. I said, what does your policy say? All you need to do, just go and read your policy. Every of the answer that you need is there. Sometimes you may need somebody to dissect it for you, which is fine. Everybody we can't all absorb the same thing at the same time. So first of all, team structure, staffing ratios and coverage. Sometimes you have 100 staff members. You want to manage all of them, do supervision for all of them. What? And then you're complaining that you're tired? You won't be tired because there's no staffing ratio and coverage in place. There's no structure in place. And if the structure, which is you with the foundation, is weak, what will happen? Everything collapses. That's where that will be due. That will be a long due of audits that you need to carry. You know that you need to carry it out, but it's long overdue because you're overwhelmed, trying to coordinate, trying to supervise, trying to spot checks at the same time. So compliance, audit system. How often do you want to do your audit? Is it weekly? Is it monthly? Is it quarterly? Have this in place. This is what you need to build. Incident tracking. How often do you want to track your incident? Every day, weekly? Know the number of incidents that happens and make sure that reduces at least every week. Supervision appraisers, who is in charge of it? Can you recognize anyone that is competent enough? And competency is not just about the qualifications that they have. Qualifications can be acquired. You can tell some zeal from some, the qualification can be acquired. They can register for it later on. But do they have that zeal? Do they have what it takes? Do they show a glimpse of that skills that is required to carry out the compliance checks? So care plans as well. Care plans, quality checks. So those are your CQC evidence engine. Commissioning, aligning training with funded priorities. For example, we have the OMTT trainings, LDSS funding from the NHS Business Authority. These are some of the things that some people are still not aware of it, that they can claim back. And what cost can they claim back? And how much can each organization claim back? Thousands of pounds that you can claim back on your staff development, depending on how you structure it again. So all this funding is also available. How do you build relationship with your LAs? How do you build relationship with the ICBs as well? How do you track? So commissioning is very important. Commercialization, because at the end of the day, you need cash flow. The business needs to move on. You need to look at the cost and performance tracking. We have this training. How is the staff performing? If you're a care home, for example, are you still relying on agency? Have you been able to improve your retention? With this organization I mentioned, when they had requires improvement, of course, they lost some contracts with the local LAs. Some staff members left the organization because sometimes nobody wants to be aligned with anyone that require improvement. They lost the staff members. She was able to recruit some staff members as well. The new registered manager was able to recruit some staff members, and they've been able to retain them as well. So looking at that too, these are some of the step 2 that you need to take. And what is the next step? Because of our time, again, install that system. When you deliver the training, structured training, not just random, not because other people, other organizations are doing it, not even because the funding is available. Does it correlate with the organization? Does it relate with the service users we're providing service for? And do it based on a real service gap. So for example, it could be that the staff members, there is no teamwork in between them. Teamwork, for example, is not mandatory to say, but you can have a teamwork meetings, teamwork training for them that would, help them just to reorientate them. So it is based on your real service gaps, not just about mandatory training. We've done medication, we've done moving and handling, and that's it. Sometimes it's a real gap within your service. How are they? Do they have a sense of lack of responsibility, for example? What sort of training would they need so that everybody will feel involved, everybody will feel responsible for that service? That is what you want to do. And staff using that learning in real care delivery, you would hear it back during the supervision. Because that's one of the things that CQC would note of. They will take note of when they ask them questions. And they could ask any of your staff members questions. So do the managers observe as well? Do you maybe one time you go to visit some, you cannot, if you have a service of 400 staff or 400 service staff, for example, you cannot visit every one of them, but do you speak to them on the phone? How often do you speak to them? Do they know who the manager is within the service? Because some of the CQC report that we've read said, don't even know who the manager is. Do you speak to them? Do they have a sense of who you are, within that service? So check again, audits, spot checks, competency, feedback. So train, apply, check, and improve. So it is a circle of what you need to do. Train your staff members, assess their competence, track their records, the spot check, the competency, improve, and then show your evidence. This should go on every single month, because once it's left undone, that's what creates a lot of gaps. So every month, how can you create your own monthly system? Every month, have at least, and when we say training sessions, it's not necessarily moving and handling. It is not medication training. It is not about safeguarding training. It could be on teamwork, just 2-hour CPDs. And there are loads of free trainings as well that you can take. The local authorities have some free training that they can do. When I was a care coordinator, one of the things that I did is I made use of the local authorities' free training for my staff members, because they also like the idea of going out to local authorities to train. That give them some, that increase their self-esteem. That is the feedback that I got. It increased our self-esteem. Going out to do local authorities, it is not just about e-learning. Anybody can do e-learning. Sometimes when I'm doing e-learning training myself, I could just keep scrolling, because you have subconscious mind that you already know the answer, and you just click on it. Majority of the things that are reading, they're not reading it as much. So have a training in place, and the training could even be during your staff meeting. That's one training. Pick one topic that you like to discuss during your staff meeting. Staff supervisions. I know staff don't like to come to supervisions because they think, yes, that's when everybody will tell me what I'm doing wrong. Everybody tells me anything that what I'm doing wrong. That's when they identify that I've been late. Make sure, try as much as possible to shift their mindset from doing something wrong to actually what is needed. I always say to them that supervision is 2 ways. I'm supervising you and you're also supervising me. That's an opportunity for staff members to ask me questions. That's an opportunity for staff members to ask me what it to give that input on how this organization can grow. That is where I see it. And when things happen like that, I don't just immediately call for supervision. I have a chat on the phone with them. And it helps me then as a registered manager because I also did a training. So during induction, I'm also stimulating them, trying to, letting them understand the values of the organization. And I tell you, sometimes during our induction, after we've gone through all the trainings, some people don't come back, and that is fine. I'd rather you don't come back and then come back and be a problem for the organization. So, and then they get the picture from them. This is what we're trying to do. And throughout my service as a registered manager, I can count with my finger how many safeguarding we had. One of them, which was within the month, and most of them is what we raised, is what the staff member raised. So competency check is very important. Audit reviews as well. Incident analysis. This will become your own operating system. And one size does not fit all. As you have your own personalized, care plans for your service users, every service will be different. Every service will be different. So what can you start doing now? What you should do right now? Don't overcomplicate it. Don't overcomplicate it. The first thing you need to do today is identify what are the top 3 service issues. See, I tell you what, there are some issues that you cannot wave away. You cannot wish them away. You know what they call them? I'm doing MBA. We call them wicked problems. We call them wicked problems. Wicked problems are problems that when you try to solve them, another problem comes up. When you try to solve them, and one of the problems is the health and social care staff turnover. It's a wicked problem. So you try to recruit staff members abroad, or you try to recruit locally, it's not working. You pay on Indeed, it's not working. Then you try to recruit abroad. They come in, they don't understand what's like to work in the UK. You train them, you do everything possible. Mistakes don't happen. So there are some problems that it is not your fault. There is not absolutely, and see, even the government, they have the whole budget. They can't do nothing about it just yet. So why it's called bigger problem is there is no single clear cause. It does not have a simple solution. Some people have said, oh, maybe increasing the salary may. It could not. Some people will say, I'm not working for the salary. I'm working as a care worker because I love it. And then some people will say, yeah, they're paying me to go and do this. They describe their work. I'd rather get paid less and work in another environment. See, that's why there's no clear solution. There's no simple solution. And the thing is, it's constantly changing. So they increase the salary. Things happen. Staff members will still go back again to do so. So there are some problems that you cannot wish them away. It is not you. And it involves, wicked problems is also something that involves multiple interconnected issues. So they increase the staff salary. They increase the NI. What then happens? The cash flow of the organization falls. And then the government are not increasing what the LA is giving. So can you see that it goes back round the circle and round, and it is not fixable. One action cannot fix it. But what you can do is you can work around it. You can set up your own system and work around it. So even though it sounds simple, for example, we have a high turnover within our service. It sounds simple, but it's not. Look, why do we have high staff turnover? I read a post about a care provider. He said for the past how many years they've started a service, they have never had any agency staff. They've never had any agency staff. And one of the things he mentioned is the leadership of the organization. So look at, high staff turnover, could it be weak culture? Could it be that there is inconsistent training? Could the staff be burnt out? The staff rota, how is it planned? Is it that there's no lack of career progression, which is some of the problems that we face in health and social care? See, that's why it's called a wicked problem. So when the and CQC, of course, when they come in, they're not inspecting the tax, they're also assessing how do you manage this complexity. So identify what are the top 3 service issues that you have. Link them. Can training help? Do they need to have a competency check? Would auditing help? And can I create a monthly review of this process so that it keeps going on and on and on and like that? So identify these 3 problems, but also have it in mind that there's some problems that they're wicked problems, and it takes one and the other to be able to solve. So it takes the government and the health and social care department, the Department of Health and Social Care, the government to increase the salary. So it takes all of this, all of us working together, and that's why some organizations are also working tirelessly to ensure this happens. So it's structured. Once you're able to structure your system, then you have a clear governance. Also, your staff competency, of course, you're able to identify some gaps in training, you train them, you're also able to check their competency. That would then lead to a safe service and, of course, well-led. But once you do it, make sure that some people, daily compliance works. Some people is weekly compliance. Daily compliance actually helps you to eradicate a lot of problems. So you have daily alert, a missed calls alert, missed medication alert. You are immediately notified that somebody has not visited Mrs. B, then you are able to do something about it right there, right now, before it becomes a missed call. Continuous improvement. Rome, again, wasn't built in a day. We've made a mistake. We've accepted a mistake. That's duty of conduct. Duty of accepting, being honest and open. When we've made a mistake, and this is what we're doing to make sure that this mistake doesn't happen. But also remember that we are talking about individuals. There are some mistakes that are inevitable, but there are some mistakes that should be avoided, and we should do everything possible to avoid that. And when we're able to put this in place, then we'll be ready for inspections, which could be any day, anytime. And I say, on the day of inspection, be relaxed. See, the person that is coming to inspect you, they don't know. They have an idea about your service, maybe because you've completed a PIR. They've probably spoken to some of their few clients, or maybe not. Maybe they haven't yet. They're about to ask you. You know about your service. You know about the daily activities that you do. And once you're able to document it, all you have to do is evidence it. This is what we do. So they don't know about your service. They don't know about your service users. They don't know that they visited the hospital 5 times this month. You know about it. You know how much you care for them. You know how competent you are. You know how flexible you are with your clients in terms of the queries. So how effective your service is. And you just have to evidence that. That's what you need to do. So again, train, apply, check, improve, evidence. That is what CQC wants to see. That is what CQC wants to see. And the evidence is not just about the training alone, it's about the competency and the feedback too. If you want to talk about CQC and if we deep dive in, we'll probably spend all day looking at that. But you know your service the best, and you know what you need to put in place. So don't forget to identify those 3 areas. So again, this is just a recap of what the 5C is. Capability, talks about the regulation 18, the under competency. Capacity, your safe staffing. Compliance, regulation 17, governance. Commissioning, external relationship is very important. Commercialization as well. How would the company survive? How would the company be sustained? We want to provide the best service possible. We want to increase our staff salary. We want to retain our staffs. But then again, looking at the long run, because if there's no company, this same staff will still leave your organization to work for someone else. So how do we ensure that this service is sustained? You also have to look at that as well. So build the systems that work for your organization. But if you require any further support, these are contact details on the platform. So I'm going to leave the room now for questions and answers. So if anybody has any questions that you may want to ask us, about how we can support your service. Again, everybody is learning. We are all learning, and we want the best for our elderly ones or our children, depending on the service that we're providing. So we want the best for them, and that is why we are here. So if you have any questions, some people might be here and they may even answer that based on their experience as well. So please don't hesitate to ask any questions. So thank you very much for attending today. We hope that it has been helpful for you. By the end of today, we will send you some, some of the questions that we said, we would you could ask. So we have these 5 questions. We have this in different areas under capacity, capability, under your commercialization. So we have this set of questions that we've been able to create for you that will give you an indication of where you are and they know where to start from. So we will send that to your individual respective emails. So if you can complete that as much as you can, honestly, because it's better again to be safe than sorry. Complete that as honest as possible so that you will know where you are within your service and then what you need to do going forward. Because as I said, some of you might have inherited a requires improvement service. You might have inherited a bad culture, and then all you're trying to do now is trying to improve it. So be as honest as possible and complete that. So thank you. Do you have any question? Okay, we'll try and provide the recording. I'll stop sharing now so I can see. So is there any questions at all? Any question or any suggestions? What is working for you? What are you currently doing within your service that you've seen an improvement that you may want to share with someone here? Okay. In the absence of no questions, we'll be bringing the webinar to a close. Once again, thank you very much for joining. We hope this session has been helpful for you. So if you do require any further support, you can write to us at support@dominionconsultancy.com. Again, it's not just about the training, it's how well the training aligned with your service. We do have various range of training support from Oliver McGowan training down to medication, down to safeguarding. We also support you with your compliance checks as well. We do have ex-inspectors that work for us that support. We do have ex-consultant registered managers like yourself that also support, that understand the service, that understand what it's like, to lead a service. It's not an easy task. It is not, I must say. So they understand. So they're not there to pinpoint out what you're doing wrong. It's also to elevate what your strength, and also if there's any area that you may need support, to put support in place. But most importantly is to help you to put a system in place so they are running one another. They are running one another each month. So you can write to us as well if you need any further support. So thank you once again. I remain Olayinka. If you'd like to, I would love to connect with you. I'm just going to leave my LinkedIn page. I do share some important information on LinkedIn. So if you'd like to connect with me, I would absolutely love to connect with you too. So I'm going to share my LinkedIn page shortly now. So if you can share yours as well, I would love to connect with you too. Thank you very much. Thank you. So you can connect with me using that link. Thank you very much for attending. And I hope you enjoy the sunshine. Enjoy the rest of your afternoon. Thank you. Bye for now.